Hi, I'm Dr. Antimarino. Nice to meet you.
Nice to meet you as well.
Why don't you have a seat? I understand you're here to talk about a possible breast reaugmentation.
Yes.
Well, let's talk about a few things before we go through the examination. First off, you had your first breast augmentation about 12 years ago, and you think you might be having some complication with the implants.
Yes.
Okay. Well, it's not uncommon for ladies, especially more than 10 years out, to start finding things going on with the implants. What we find is the longer a woman has breast implants, the more likely she's going to have some local complications. Most of them are not serious, but what she finds is that her breasts become a little more firm, called a capsular contracture. If she has saline implants, she can see more rippling. She can certainly have a deflation of one or both of the implants if they're saline implants after 10 years. If you have an old gel implant, sometimes you can get some gel bleed through the shell of the implant, and that can cause some firmness as well. Implants can also migrate a little bit. So when you're lying down, the implants can shift towards your chest wall or even towards your armpit a little bit. Lastly, you can have changes in your breast tissue as you get older as well. Certainly after breastfeeding and pregnancies, and weight gain and weight loss certainly influence the breast tissue. So this re-augmentation procedure is really to assess all of that, to remove and replace your implants. But if you do need a breast lift to help take up some of that extra skin, that can be done at the same time, and it can be done safely. Third, now, implants have come a long way since you've had yours, and there's been a lot of changes in the evolution. Now implants are various sizes and shapes that you didn't have available to you. I prefer the round implants, but there's also anatomical shape. Some of the ones that we have today, this is more the style that you have, which is a little bit wider and flatter. As implants go up the ladder, these are the same volume, but you can see different shapes. So this middle one is the one I use a lot for breast augmentation. So as you can see, putting this newer style implant, which will actually fit your body a little bit better and give you back that projection you used to have, into a breast with a capsule that was shaped for this implant, is not simply pulling one out and putting one in. This capsule, that scar tissue that shaped this one, now needs to be modified to allow this one to really give its full projection. So I've actually designed a pocket revision that can concentrically downsize the radius or the diameter of this implant to this one, and also modify the dome of the breast so that it allows this implant to give you that full projection forward. Every woman wants a breast that's narrow, but gives her a lot of projection. So you'll find that these implants are going to be better suited for you. Another good thing is the downtime is really not any different than you had last time. You may not remember it, but it's been 12 years. So I keep you out of work for a few days. Most women go back to work within the week, depending upon their job. I don't let ladies work out for approximately 3 weeks. Minimal house cleaning for 3 weeks. And lastly, as you already know, implants don't last forever. So just like you're doing now, after about 10 years, I always recommend women seeing a board-certified plastic surgeon every year, every other year afterwards, just to assess the integrity of the implant. Have I answered all your questions so far before I examine you?
Oh,